Hello everybody and welcome to my channel. I'm Mariah. Today's topic is Batten disease. This video is research based, and in this video I will cover what Batten disease is, types, causes, symptoms, diagnosis, treatment, and prognosis of Batten disease. All the information I'm presenting in this video is from 3 different articles. What is Batten disease? This is the first article from Batten Disease News. Batten disease is also known as neuronal ceroid lipofuscinosis. It refers to a group of rare inherited neurological conditions that cause vision loss, progressive motor and cognitive decline, and seizures. This disease is thought to affect between 2 and 4 of every 100,000 people living in the United States, and about 1 in every 100,000 worldwide. It takes its name from the British pediatrician who first described Batten disease in 1903. Types of Batten disease. There are different types of Batten disease classified according to the age of the onset of symptoms. Disease symptoms can manifest at birth, which is congenital, or appear during childhood, which is infantile, late infantile, and juvenile, or adulthood. Childhood forms are the most common, often appearing between the ages of 5 and 10, as vision problems or epilepsy, which is also known as seizures, or simply as problems with learning and general clumsiness. Batten disease types. The second article from Batten Disease News. Batten disease is a severe heritable nervous system disorder. Although originally used to describe only the form of disease that begins between the ages of 5 and 10, or juvenile onset disease, the term Batten disease is now known to describe a group of 5 related conditions, all collectively known as neuronal ceroid lipofuscinosis, NCLSs. NCLSs are caused by the buildup of insoluble waste deposits called lipofuscins in the cells of the eyes and the brain, as well as the skin, muscle, and many other tissues, resulting in cell death. Five broad types of NCL are described below. Congenial NCL. Congenial NCL is the rarest form of disease, with 10 cases having been reported worldwide. Babies are born with microcephaly. I'm sorry if I'm saying that wrong, which is also known as very small heads, as a result of abnormal brain development. They often have seizures, difficulty breathing, and soon die after birth. Infantile Ncl, also known as INCL or Santorini Halatia disease, and I'm sorry if I pronounced that wrong. Infantile Ncl symptoms appear between the ages of 6 months and 2 years. It is characterized by seizures and the loss of mobility, and often progresses to a vegetative state. Some babies also develop microcephaly and may die before age 5. Late infantile NCL or LINCL or Janskaya-Buylkowski disease. Late infantile NCL appears between the ages of 2 and 4. Children have ataxia, which is known as loss of muscle coordination, and seizures. This form of disease also progresses rapidly and results in the loss of cognitive and mobile capability. Some children live into adulthood, although most have a shorter survival rate. Juvenile NCL or JNCL or Spielmeyer Meyer, Vogt, and I think this is Shergin Batten disease. Juvenile NCL is the most common type of NCL. Symptoms begin between the ages of 5 and 10, usually with the loss of vision and seizures. Early symptoms can be very subtle, such as personality changes. As the disease progresses, children lose the ability to move or communicate, and many develop dementia. This form of the disorder is often fatal in the late teens to early 20s. Adult NCL. ANCL, Perry's disease or cough disease. Adult NCL is the only form of disease in which symptoms appear in adulthood, generally before age 40. Symptoms are milder than the other types of NCL and progress more slowly. While less severe, this form of the disease also has a reduced life expectancy. Adult NCL is further described into two subgroup types, Type A and Type B. They can overlap in symptoms between two subgroups and differentiating between the two can be difficult. Type A is associated with progressive myoclonal epilepsy or seizures associated with muscle contractions. Some people also experience ataxia and dysarthria, which is difficulty speaking as a result of muscle weakness or tremors. Type B has symptoms similar to Type A, such as ataxia, but rarely involve seizures. Some individuals develop dementia as the disease progresses. Batten disease symptoms, diagnosis, and treatment. And this is from WebMD. Symptoms. Over time, Batten disease damages the brain and the nervous system. And here are some common symptoms. We have seizures, changes in personality and behavior, dementia, speech and motor skill problems that get worse over time, diagnosis and tests. Batten disease is often misdiagnosed because it is rare and many conditions share some of the symptoms. Since vision loss is usually one of the earliest signs of disease, eye doctors can be the first ones to suspect a problem. Several exams and tests might be needed before your doctor can make a diagnosis. Doctors often refer children to neurologists if they think they need more tests. These are different kinds of tests a neurologist can use to diagnose Batten disease. We have tissue samples and eye exam. By examining tissue samples under a microscope, doctors can look for the buildup of certain kinds of deposits. Some doctors can see these deposits just by looking in a child's eyes. As the deposits build up over time, they can cause pink and orange circles to develop. This is called a bullseye. Blood and urine test. Doctors can look for certain kinds of abnormalities in the blood and urine samples to indicate Batten disease. Echo and I'm just going to call it EEG because I cannot pronounce the full name. This test involves putting patches on the scalp to record the brain's electric currents and look for seizures. Imaging tests, CT scans or MRIs help a doctor see if there are certain changes in the brain to indicate Batten disease. And we have a DNA test. If you know members of your family have Batten disease, you can get a DNA test to confirm a diagnosis. Treatment. There are no known treatments for any form of Batten disease. Symptoms like seizures can be improved with certain medications. Other symptoms and issues can be treated too. Some people with Batten disease get physical and occupational therapy to help them function. Scientists continue to research possible treatments and therapies. I hope you enjoyed this video. I'll post the articles that I use in the video description along with a brief I will post the articles that I use in the video description box along with a brief video description. As always, I'm open to any suggestions you have for any future video topics. Please let me know what they are in the comment section below or on my Twitter page, and my Twitter handle is at BurleyMariah, and I can spell it for you, at BurleyMariah. My next video is going to be on what is an IEP and what it includes. This topic is subject to change if anyone wants me to do a different topic instead. I hope you guys are staying safe. I want you to know that I'm praying for you, your families, and the world. I will post my notes in the comment section for anyone who needs them. Please like, share, and subscribe if you want to and found this video to be helpful. Feel free to share this video with anyone you think might need it. If you want to be notified for when I do any live streams or upload any new content, you're going to want to hit the bell icon and select the all option under the bell icon. Thanks for watching. I love you guys. Bye!